The number one reason that parents bring their kids to the emergency departments is for the fever. The number on the thermometer is the most distressing part of their illness. I think a lot of the anxiety is around the myths of like things that happen at 104°F, like you're going to get brain damage, which there's no truth to that, or you're going to have a seizure, and seizures can happen at any temperature. It doesn't have to be 104. A lot of people think the higher the fever, the more severe illness, and there's no truth to that either. Some of the highest fevers that we see are from roseola, which is a normal childhood infection. Fevers start at 100.4°F or 38 Celsius. Even if you run low, even if you're 100 degrees and you don't feel good, it's not a fever until it reaches 100.4°F. And fevers are our friends. It's our body's way of helping fight infection. As long as they're not in a high-risk category, if your kiddo is sick, the most important thing is to not look at the number on the thermometer, but to look at what the kiddo looks like. Are they getting dehydrated? Are they struggling to breathe? Are they responding appropriately? Is there another concern that you're concerned about? Then it's time to get checked out. The most common reason the temperature will not come all the way down is that the medication dose is not appropriate for the kiddo, so you can talk to your pharmacist or their pediatrician to get an appropriate dose. Please, for all of the marbles, stop spending $50 on the forehead and the ear thermometers. They are not accurate. Spend $12 and get a simple digital thermometer. For little kids, a rectal temperature is best. For bigger kids, you can do the armpit or the mouth. It's fine. Because we are not treating the number, we're treating the kid. We're going to give them fever medicine when they get uncomfortable, especially if they're not drinking. They do lose more fluids when they have a fever, so make sure they're staying hydrated. There's no high number when you need to come to the emergency department. If your kiddo looks sick, that's when it's time to come in. Let's review. If your kiddo has a fever and they're running around and they're comfortable, hand them something to drink. If your kiddo has a fever and they are uncomfortable, hand them something to drink and some ibuprofen or some Tylenol. If your kiddo has a fever and they're struggling to breathe, they do not look well, they're not responding to you, they're getting dehydrated, or you have other concerns, it's time to head to the emergency department.